that inspired me to become a physician was my family. Growing up, I have such a big family and I'm really close to them. I saw a lot of my family members go through a lot of things with their own medical conditions, things like heart disease, things like diabetes, things like stroke, things like cancer. And growing up, I saw so many of my family members step up to become caretakers, and I would help out the best I could as a kid. As I was growing up, I really thought it would be really cool to be on the other side of things, being able to help so many other families who are in need as they were battling their own medical conditions. I think becoming a physician is one of the best things in the world, and I wouldn't trade this job for anything. So my education experience becoming a physician started with my 4 years of college. I went to Clemson University in Clemson, South Carolina, where I studied biological sciences. Afterwards, I attended the Medical University of South Carolina in Charleston, South Carolina, where I got my medical degree. After that, I attended the University of North Carolina in Chapel Hill, where I did my residency in physical medicine and rehabilitation. After that, I went on to the Medical University of South Carolina once again down in Charleston, where I did a fellowship in interventional spine and musculoskeletal medicine. In that field, I learned how to perfect and get expertise in the field of interventional spine, which is the majority of my practice, where I do lots of neck and back and orthopedic injections to help people get back to living. So my areas of expertise are spine, that's my primary area, but I see pretty much every musculoskeletal region. And so I see a lot of patients with shoulder pain, hip pain, knee pain, any of the large joints, but I'd say the vast majority of my patients have neck pain or back pain or mid-back pain, and a lot of times we're doing things non-operatively to help them get back to their previous level of function, get them back to living life the way they want to. The thing I enjoyed most about working with my patients is just seeing them get back to living. A lot of my patients come in, and one of the most rewarding things they can tell me is that, "Doc, because of you, I was able to attend my daughter's wedding. I was able to go to my high school reunion. I was able to go on that family cruise we've been waiting 20 years to go on. I was able to travel. I was able to do all the things that they've always wanted to do, but their back pain or their knee pain or their hip pain was preventing them from doing so." One of the really cool things about orthopedics is that even though the name is orthopedic surgery, a lot of times you can treat a lot of orthopedic and musculoskeletal conditions without having to do any surgery. A lot of times we start patients out with a conservative approach. We try things like home exercises, physical therapy, aquatic therapy. But if they've tried all of that and they're still having pain and discomfort, a lot of times we have cool interventions where we can help patients get back to their previous level of function or even better without having to do surgery. One of the things I do is lots of injections, a lot of interventions where we can get people better still without having to do surgery. So one of the things I really enjoy doing outside of my clinical work is actually helping the next generation of doctors. I love mentoring and lecturing, helping that next generation become the doctors that they want to be. It's definitely a time commitment, but it's so important. I think mentorship is key in order to succeed in a lot of things in life, and especially in medicine. So that's one of my hobbies and one of my passions. The greatest accomplishments I think that I achieved is just being able to wake up every day knowing that I gave it my all, giving my patients my very best, trying to be attentive to them, trying to listen, trying to communicate, really trying to understand them and trying to figure out exactly how they can get better, how I can help them get to that area where they want to be, get them to that level where they want to be, get them back to their family, get them back to their job, get them back to living the life that they want to live. My name is Dr. Gregory Franklin II. I'm with Piedmont Orthopedics, Ortho Atlanta. Let's get you back to living.